Today we are diving into the intense words of Chicago's Med's first episode. We'll be focusing on emergency medical scenarios with special attention to anatomy, physiology, wound healing, and pain perceptions.
Okay, here we have Khairil, and my name is Ilhan, Zahid, Irfan, Abigail, and also Yuen. Okay, today we will break down the concepts and clinical procedures that you can see, also adding our expertise here. So guys, let's go. Yes.
Sir, you okay? You alright? Everybody okay? Sir, can I see that for a second? Can I see that for a second? Alright. It doesn't look too bad, alright? You're gonna be alright. Call out if you need some help! Mister, you calling 911? Yeah. Alright. Take a look at that for a second. This is doing alright? Oh, God.
CFD Plan 2 mass cash. Multiple trauma patients minutes away. Let's go. What do we have?
45-year-old male, left leg amputation.
Treatment 2.
Trey Motorman, GCS3, BP of 90 by PAL.
You can see the doctors assessing the patient with the Glasgow Coma scale. This scale is essential in emergency medicine, helping to gauge the severity of brain injuries. It has 3 parts: eye-opening, verbal, and motor responses. Each has its own score brush and has a lower total means of severe head injuries.
GCS also helps in deciding whether to intubate the patient or not, because lower score means the patient may need to be intubated as they might have airway problems or airway issues. So as oxygen supply is really crucial to prevent secondary brain injury due to hypoxia.
Exactly. A GCS below 8 is considered critical and signaling the need for intubation since there's a high risk for further decline. Yeah, it's basically the difference between brain cells surviving or dying. So for instance, a score of 4 means eye opening is spontaneous, while a 1 means no response. So monitoring this scores is critical since a decline can signal worsening brain injury and needing intervention.
Go to trauma 4.
Maggie, I need an X-ray here.
I got you.
Crossing.
Oh, hold it. Watch out.
Katrina, how are all these walk-ins making it through? Let's set a perimeter.
Let's get her into treatment too.
Damaged artery rather than seeing a damaged vein. So guys, let's discuss why that matters.
Good point. Arteries carries oxygen-rich blood directly from the heart. So when an artery is damaged, blood loss is fast and hard to control. This kind of bleeding can rapidly lead to hypovolemic shocks, which reduce blood flow to vital organs. In hypovolemic shocks, the body compensates by constricting blood vessels to prioritize blood flow to essential organs. But if blood loss continues, these compensatory mechanisms can fail, so risking the organ failure.
And this is also ties into wound healing. The body's response to such bleeding is homeostasis or clotting, which temporarily seals the wound. Clotting is just the beginning of the healing process, which is essential to prevent blood loss and also allow the tissues to start repairing. And you'll often see pressure applied to wounds like this to manually compress the blood vessel. Slowing down blood loss while clotting takes effect. Every second counts in case of arterial bleeding.
keeps biting down. I can't get the blade in. Look, you bag him, I'll do CPR. Come on. We're almost there. It's not time yet.
Also called bagging. It's a quick fix for patients that can breathe effectively on their own. However, it's a temporary measure. Bagging can be less effective than intubation because it's challenging to control the oxygen flow and pressure. They want to intubate as soon as possible.
And notice CPR is happening alongside bagging. Chest compression are vital to keep the blood circulating, even if some ribs break in the process. It's necessary to keep the organs alive.
Definitely, the mechanics of CPR here are interesting too. Compressions need to be at least 2 inches deep for adults, ideally using 2 hands. But on a moving ambulance like this, in the scene, it's tough to maintain the depth consistently. So, especially if the medic has been at it for a while.
Trigger an all-hazard disaster plan. Page the phone tree. Right away.
28-year-old male, crush injuries, severed artery, massive blood loss.
Trauma 3 just opened.
Got a tourniquet on his right leg. Tried to intubate but couldn't get his jaw open. He lost his pulse on the ride.
Put him on our monitor and rapid transfuser. Grab 4 units of O-neg and start with the round of epi.
Already hit him with the...
Blood is a universal donor since it's blood of A, B, RH, and RH antigens, which minimizing the immune reactions. And also rare because only 6.6% of people have it. So they will switch to compatible blood once the patient blood is confirmed.
Times 2, still no pulse, he's in fifth.
All right, let's get him in the bay. I got it from here, man.
Nope, he's mine.
Okay, who the hell is this guy?
Says he's a doc.
Get off the gurney, Doc. I'm senior resident in the CR.
Yeah, well, I'm your new trauma fellow.
Dr. Halstead.
Female.
Where's your line? Left AC, obvious femur fracture, good distal pulse.
It's blown.
Sweetheart, we're gonna take good care of you.
Hold compressions. You are?
Sarah Reese, 4th year med student.
Can you do a course in the groin? Mm-hmm. Get a left femoral in there.
Yes, sir.
There, you're sterilized. Now stick it.
He's a patient, not a pincushion.
I can't find the vein.
In these situations.
Yes, shock or dehydration can cause veins to collapse, making it difficult to insert an intravascular. And the added stress can make their hands unsteady, which the patient feels as pain. Repeated pulse can also stimulate pain receptors, which only adds to the patient's discomfort. But luckily, the patient was unconscious.
Yeah, but in a conscious patient, the pain and stress will trigger the body's fight or flight response, which can make the veins constrict more further. Yeah, this is a perfect example, shows that how emotional and physical stress impact the vascular response.
All right, shock to 120. Clear.
No pulse?
Again, 200. Clear.
I have a pulse. Sinus tach at 112.
And he's back. Get a BP and keep giving him blood. Send a rainbow of tubes into type and cross. Get his blood gas and get him to the OR.
So which means they are testing for multiple things, and each color corresponds to a different type of um, blood test. So, and for this one, it is like clotting or cell counts.
This is crucial for assessing the patient's overall state. For example, a complete blood count can indicate infections or anemia. The tube used is a lavender-colored EGTA tube, while the PT&R test assess protein, which is key for wound healing, and are taken in light blue-colored sodium citrate tubes.
The type and cross match mentioned in the video here ensures compatibility for blood transfusions, because this is important because O negative blood is rare, as mentioned before. So they want to save it by giving the patient their blood type once they confirm it.
Did you find my dad yet?
We will, sweetheart. Don't you worry. All right, now we're gonna put something in your arm to give you medicine. It's just gonna be a little pinch, okay?
Make a fist for
Squeeze
me,
my
honey.
hand.
Make a fist.
Look at me. Squeeze my hand. We're gonna count to 3. Look at me. 1, 2, 3. All done. Good job. There you go.
Let's get X-ray in here.
Sharon Goodwin.
Pleasure to meet you. Is every day like this?
Some days we're busy.
20-year-old male, cystic fibrosis, complaining of chills, labored breathing, temps 98.
Jamie.
Hereditary condition that causes thick, sticky mucus to form in the airways, making it hard to breathe and prone to infections. These infections can damage the lungs permanently, which complicate the healing process. Without proper oxygenation, tissues struggle to repair, and chronic inflammation adds to the damage.
Yeah, and because CF affects the mucus clearance, patients often use devices like the vibrating vest to loosen the mucus. And it's almost like chest physiotherapy but automated. So the vibrating vest works by creating rapid oscillation on the chest, loosening mucus, which then helps CF patients cough out the blockage. This helps prevent the infection and keeps airways as clear as possible.
Hey, Maggie.
Back so soon?
I missed you guys.
Respiratory rate is 26. Let's take him to treatment 6.
All our ER docs are busy. Can you take care of our friend?
No problem. Deep breath.
Hey, Jamie.
Maybe today wasn't such a good day to drop in.
Oh, we always got time for you.
Let's get a CBC, a CMP, coags, a chest x-ray, and an ABG.
Yes, doctor.
Now, Mr. Dilson, I see that you're using inhaled antibiotics, tobramycin, albuterol. You wear a vibration jacket at night and use a humidifier?
Yeah.
That's all good.
I caught a cold.
A whopper.
Well, we gotta make sure that it doesn't turn into pneumonia. You've had a few episodes.
Few means 3. I've had more.
Well, we're gonna take good care of you here, okay? You're at Northwestern?
Yeah.
Well, we better get you out of here quick so you don't miss those midterms.
Make a fist.
Jamie, I've got your test results back. I wish they were a little more encouraging. You're pancytopenic, which means that your cell counts are low. You've got a blood pH of 7.14, which means
I know.
you... I'd like to intubate you, put you to sleep, get you on a ventilator. You're getting fatigued. This would just allow you to rest so that the antibiotics can do their job.
I've been intubated 8 times.
Occurs when the body retains too much carbon dioxide, leading to acidic pH of the blood. Excess carbon dioxide can lead to an acidic environment in the blood, which impairs the enzyme activities vital for the cell repair, and also slowing the healing and increasing the infection risk. An acidic environment also can trigger inflammation in the vascular system.
The intubation reduces the respiratory efforts, letting the machine's breath for the patients and stabilize the blood gases more quickly.
Yes, especially with respiratory acidosis, intubation is life-saving as it supports oxygen delivery to tissues that need to heal and prevent carbon dioxide buildup, which would otherwise worsen acidosis.
I need to talk to your mom.
So, about your husband.
What?
No, he's okay. He's still in surgery. The OR nurse says it's going well. As soon as we hear something, I'll let you know. Rachel? Rachel, can you hear me?
What is wrong? What's happening?
I can't find a pulse.
Oh my God.
Little help here!
You're not compressing the heart, Sarah. You gotta go harder.
But she's so small, I don't want to...
Harder, do it. Let's go. Come on, Sarah, harder. Hold. There we go. Back inside us, get a BP.
What happened?
She arrested, we got her back.
I can't get an IV. Hand me your drill, get an IO line. I got a line.
When they use an intraosseous or IO line, since veins in children can be hard to access, especially in emergencies like this. So, injecting medications directly into the bone marrow can be used in this situation because that is the quickest route for life-threatening situations.
It's a painful procedure though because the periosteum, the outer layer of the bone, is highly sensitive. So pain management is critical as excessive pain and stress can release hormones that disrupt healing. Fortunately, the patient is not conscious at this moment.
I'll take over.
Ma'am, I'm sorry. We need some more room.
Hold compressions. No pulse. Sinus tach. He's profoundly hypertensive. Amp of epi, max of dopamine, max of vaso.
You're gonna max him on pressures.
Don't have a choice. Pads.
Epinephrine here is used as a vasoconstrictor to manage hypotension or low blood pressure by tightening blood vessels and boosting circulation to vital organs. This approach is effective, but too much vasoconstriction can reduce blood flow to healing tissue, slowing down recovery. It's a balancing act in critical care.
Wait. Let's discuss about wound healing for a second. After bleeding stops, the body's response shifts to inflammation, which brings immune cells to clear out debris and prevent infections. It's uncomfortable but unnecessary for repair. However, if prolonged, it can lead to chronic swelling and tissue damage, delaying the recovery.
Yeah, so following the inflammation, the body will enter the proliferation phase where new tissue forms. This eventually leads to the remodeling phase where tissue gains strength over time. Factors like poor oxygenation, infection, or stress can hinder this entire process.
And pain signals the body to protect the injured area, but excessive pain can release stress hormones that can disrupt healing, slowing tissue repair.
That's very interesting.
And that's a wrap. I hope you guys enjoy this real life anatomy and physiology principles. And thank you for joining us. Ta-da!